Cataract is basically opacification of the lens of the eye. Cataract is not a disease, but it happens with age. Uh, as most of us get old, the lens proteins they start to become more opaque, and that leads to a phenomenon called as cataract. Symptoms of cataract are usually predominantly blurring of vision, which is there for both near and distance. At times, the symptoms may also depend on the location of the cataract. If the cataract is present in the central part of the eye, in those patients, the symptoms are more often in bright sunlight or when they are crossing the roads and there is a bright light which comes from distance. They suddenly feel that there is a strange phenomena of sudden glare and they cannot see anything. That can also be because of cataract. Coming As I told, the most common cause of cataract is age, and therefore cataract is not really considered as a disease. However, in certain patients, like those who have diabetes, especially uncontrolled diabetes, or any history of injury to the eye, or any other redness or swelling in the eye, that can lead to cataract. So, whenever there is an injury to the eye, it is very essential to get it checked, especially if the person cannot see well. Cataract treatment is primarily surgical. There is no medication as of now which can control or which can remove the effects of cataract. Most important is to keep a good health. If you keep a good health, there is a very good chance that the cataract will develop at a much later age. Who are not able to manage and maintain a good health, they tend to develop cataract at an early age. Apart from that, patients who are exposed to sunlight for long durations, for long years, they also tend to develop cataract at an early age. A classical example is seen in case of farmers. Although they maintain a good health, but because they have to work for long hours in bright sunlight in their fields, they tend to develop cataract at a little early age. Cataract surgery has actually developed quite a lot over the last few years. It began from a surgery in which only the lens of the eye was removed with a large incision, and nowadays the present day surgery is so advanced that it requires only a very small incision which measures less than 2 millimeters. So the incision is practically smaller than the tip of your pen, and through that the doctors can manage to remove the cataract. They can do it by two means. One, we can use ultrasonic power to emulsify or break the cataract into small pieces. Other option which is now come up over the last few years is to use a laser to cut the cataract into small pieces, and then we aspirate it with the help of a small machine. In both the procedures, once the lens has been removed, after that we put a small lens inside the eye. This is an artificial lens. It is also called as intraocular lens or IOL. Intraocular lenses can be monofocal, in which they usually work for either for distance or near, and the patient has to use glasses for usually for near. Another option is a multifocal lens, in which we can put the lens which has both the near and distance component, and therefore the patient can see reasonably well for both near and distance without use of any glasses. Uh, at the end of the day, maintaining a good health, taking care of your diabetes is the most essential way to prevent cataract.